this video, we will provide you with a brief overview of the primary healthcare system in Ireland. For more detailed information, please see the document The Irish Primary Healthcare System, available at www.corkkerryresettlement.com. Primary healthcare services mean all of the health or social care services that you can find in your community, outside of the hospital setting. This includes G.Ps, public health nurses, and a range of other services provided through your local health office. A G.P. is a family doctor. G.P. stands for General Practitioner. G.Ps care for people from birth and childhood through to older age and end-of-life care. Most G.Ps in Ireland offer services to people with medical cards or G.P. visit cards. If you have a G.P. visit card or a medical card, you will not have to pay to visit the G.P. Most people who don't have a medical card or a G.P. visit card will pay a fee for a G.P. visit. To see your G.P., it is important to ring and make an appointment. Make a record of the time and date. If your query is urgent, tell them this on the phone. They will ask your name and date of birth. Remember, bring your medical card with you to all medical appointments. If the GP decides you need medicine, you must go to the pharmacy or chemist to collect your medicine. If you are unable to attend your GP appointment, you must ring to cancel. SouthDoc is a service to provide you and your family with access to family doctor services for urgent medical needs. They operate outside of normal surgery hours, in evenings, nights, weekends, and bank holidays. When you ring, the receptionist will take your personal details. Your call will be referred to a triage nurse who will ring you back. Following a discussion with the triage nurse, they will clinically assess whether you need over-the-phone nursing advice, an appointment with the GP, a house call, a referral to the emergency department, or an ambulance. If you are a medical card or GP visit card holder, you must bring your card with you, otherwise you will be charged for the appointment. Operating hours are 6 p.m. to 8 a.m. weekdays, and at weekends 1 p.m. to 8 a.m. In Ireland, a pharmacy or chemist sells basic medical items, over-the-counter painkillers like paracetamol, cough medicines, and more. Pharmacists can provide emergency contraception without a prescription and also the flu vaccine. If your GP gives you a prescription for medicine, bring this paper to your pharmacy or chemist. The pharmacy will give you medicine. Please ask the pharmacist to explain how much medicine you should take and how often. If you have a medical card, medications on prescription are generally free from the pharmacy, but you have to pay a prescription charge. The prescription charge is €2 for each item that is dispensed to you under the medical card scheme, up to a maximum of €20 per month per person or family. Most pharmacies are open Monday to Saturday, 9 a.m. to 6 p.m. If you see an out-of-hours doctor, remember to ask what late-night pharmacies are open. The dentist. Dental services in Ireland are provided by two main types of service. Private dentists, who see their own patients and also many of whom provide services for people with medical cards, and HSE dental clinics, who provide services for children from birth to 15 years. This service is accessed through screening appointments in your child's primary school. It is free. Adults who have a valid medical card can access a range of dental services and treatments under the Dental Treatment Service Scheme. All medical card holders are entitled to specific dental treatments, a dental examination and 2 fillings in each calendar year, and extractions as necessary. The public health nurse provides a range of services free of charge to people in your community. They include child health visits and school visits, visits and care for older people, and care on discharge from hospital. To find a public health nurse in your area, contact your local health centre. The public health nurse provides home and clinic nursing care to persons over 65 years who have a medical card. Services include post-hospital care, dressings, injections, and referral to respite and daycare. The public health nurse will visit you within 48 hours of discharge from hospital following the birth of your baby. They will continue to visit you during your preschool period. During these visits, they will provide advice and guidance in relation to food and diet, including breastfeeding, bottle feeding, weaning, immunizations, and safety. Physiotherapists. Physiotherapy uses physical methods such as massage and manipulation to promote healing and well-being. Physiotherapy treatments are often used to help restore a person's range of movement after injury or illness. Physiotherapists frequently treat problems that affect muscles, joints, heart, blood circulation, and lungs. You must be referred to physiotherapy by your GP, hospital consultant, public health nurse, or occupational therapist. If you have a medical card or a long-term illness card, you are eligible for physiotherapy services. Sexual health services. The legal age for sexual consent and intercourse in Ireland is 17 years of age. Sexual health services include the following: contraception and contraception advice, emergency contraception and emergency contraception advice, testing and treatment for sexually transmitted infections such as chlamydia, syphilis, gonorrhea, and genital warts, and testing and counselling for HIV and AIDS. STI clinics, which are usually located in hospitals, provide testing, treatment, and counselling services for STIs. Many GPs, well-woman clinics, and the Irish Family Planning Association provide contraception services, vaccinations, pregnancy testing, and smear testing, as well as services for STIs. Information and contact details are available for STI clinics nationwide, along with information about contraception and emergency contraception at www.sexualwellbeing.ie. Chemists can also provide the emergency contraception pill over the counter. Barrier contraceptives, like condoms, must be paid for. Counselling. Medical card holders can avail of the free Counselling and Primary Care service. Your GP must refer you to this service. This service is for people with mild to moderate psychological difficulties. It is a short-term counselling service that provides up to 8 counselling sessions with a professionally qualified and accredited counsellor or therapist. It is a service for medical card holders who are 18 years of age or over. The service is suitable for people who are experiencing certain difficulties, such as depression, anxiety, panic reactions, relationship problems, loss issues, and stress. For more detailed information on these services and for information on other services, please see the Irish Primary Healthcare document at www.corkkerryresettlement.com.